Fatima Kinza to introduce our respected panelist. Over to you, Fatima.
Yeah, Dr. Mukherjee, can you hear me well before I move on?
Yes.
Yeah, okay. So as Dr. Mukherjee introduced me, I'm Dr. Fatima Kinza. I'm the Vice President of Activities at Games. And today evening, I take the pleasure of introducing all of our esteemed panelists to all of you tonight before we begin the panel discussion. So beginning with Dr. Christos Zagris from Switzerland. Dr. Christos is a medical doctor from Greece, currently working as a clinician and researcher in Switzerland. He parallelly is involved in health bodies and civil society organizations advocating for cancer prevention as well as promoting a healthy lifestyle with and for young people in Europe. Dr. Christos has integrated this advocacy work into academic and professional activities, has presented evidence-based guidelines and creative health promotion initiatives at medical conferences, and organized training events and webinars, coordinated youth-led working groups, and written for peer-reviewed and popular outlets. So welcome to you, Dr. Christos. Now moving on to Dr. Mohammed Basanoy from Egypt. Dr. Basanoy is a physician and global health advocate. He's the Director of Education and Training, Business Plus Agency. He's a fellow of MA in Medical Education from the UK. He has received the AMI membership and founding member of Social Medicine SIG. He is a research instructor at several institutions and associations. He co-founded the INORS International, which is a global association for research and innovation, and the GNRA Academy, which stands for Global Nexus Research Alliance. Dr. Basanoy is the founder of the Egyptian Association for Health Professions Education, the EAHPE. That is very impressive. Welcome to you, Dr. Basanoy. Now moving on to welcoming our third panelist for tonight, Dr. Salman Khan from India. He is the Welcoming Director of External Affairs of Vada Hope Foundation. Dr. Salman Khan is a physician and active advocate in public health. He has completed his MBBS from Grant Medical College and Sir J.J. Group of Hospitals, Mumbai. He got trained in leadership and advocacy from Johns Hopkins University. He played crucial roles in the national and international organizations like MSAI, IFMSA, and REACT. He is putting his major contribution in the field of antibiotic resistance. So we welcome you, Dr. Salman Khan. And now welcoming the founder of Vada Hope Foundation, Dr. Harshita Umesh, who's also from India. Dr. Harshita is a physician and advocate of global health. Her major focus comes under climate change, human rights, and mental health. She is a part of several international bodies. She's the youth advisor of London School of Hygiene and Tropical Medicine, and she's also attached with UN Women India. Most welcome to you, Dr. Harshita.
Thank you, Fatima.
Now moving on to welcoming Dr. Karthik Verma from India. Karthik Verma is a young advocate in UNICEF India, dedicated to child rights, climate change, and immunization. His commitments towards the global health is very important. He's the child advisor to the UNCRC for General Comment 26 and Steering Committee and Major Youth Group. He has presented his nation in different international global health meetings. Currently, he is the Bivishna's Mercedes-Benz Fellow, and he is pursuing his bachelor's degree in environmental studies at the Terry School of Advanced Studies. So, Mr. Karthik Verma, welcome to you. And finally, welcoming our last panelist for today's evening's session, Parneet Kaur from India. She is a sustainability advocate, a poet, and the founder of Poetry for Planet, which is a global youth-led creative movement that reimagines climate narratives through poetry and culture. She has performed at major international forums, including the COP15 in Montreal, COP28 in Dubai, COP29 in Baku, the UNCCD COP16 in Riyadh, and the FAO World Food Forum in Rome. Her work earned her the title of Official Poet at the FAO World Food Forum and recognition at the St. Callum Symposium and Tepa, Switzerland. An impact officer for the Global Shapers Hub in Chandigarh under the World Economic Forum, she continues to advocate for climate action and social change. That's very creative and very impressive. Welcome to you, Mrs. Kaur. Okay. So that's it with the introductions. Back to Dr. Mukherjee to continue tonight's panel discussion.
I am welcoming Dr. Abhishek Kashyap as the National President of James. I want uh, to first of this.
Hi, good evening, everyone. And I think we have people from different parts of the world. So thank you for all for joining this panel discussion. So I just want to brief about the course that we planned. So the idea behind this course was to lay a foundation stone for undergraduate medical students to introduce and step into the research field and build a community around for these students. Being a researcher myself, I understand that the nitty-gritties of the responsibilities of a medical researchers, the ethics that we have to follow. So the idea was to lay such a foundation that the students can begin with to know more about research. And the idea of having a global health topic into research, because when we talk about being an organization such as James, we have to address the issues that are prevalent. And post-COVID, we are more sensitized towards global health. So, and global health has an foundation where research is required. That's why we try to integrate this topic with our course, and hopefully we'll have a fruitful session. And that's all on my side. And thanks for joining. Thank you so much.
Thank you, Dr. Abhishek. So a very good evening to one and all. To the audience, I think everyone knows that today our topic is global health, and the main focus is SDG, that is the Sustainable Development Goal. So I'm starting with Dr. Christos. Christos, you are doing research from the medical school, and you have taken part in global health activities. So how was your journey? How you started the medical research in the medical school level, and what is your suggestion to your upcoming generation or juniors?
Well, certainly. This is a question that is quite interesting, and I think that it doesn't have any correct response. In any case, in the sense that it is a question that each of us can respond for themselves. In my case, my journey began in a not so glorious way, in the sense that I was quite involved into writing. I was writing prose, poetry, and literature in general as a high school student. And after entering the medical school, I thought that this is something or that one can scale up or scale towards scientific writing. And there was a task in my first semester in the school. There was an English terminology class where we had to produce an essay. It was my first ever medical essay in English. The instructor found it nice and told me that probably I would like to try to publish it somewhere at some point. I took these words quite literally and asked her, okay, what are some medical journals? And the instructor gave me some quite ambitious examples, some of them being the BMJ and so on. Of course, it was a failure. But still, I was interested, or I got, let's say, the microbe of trying to publish something in a medical platform in a peer-reviewed journal. I kept trying for about 4 years before I made it. In this time, I got involved into conferences, I networked with people. I also had the chance to serve as the associate editor for a magazine or a journal of the European Association of Medical Students. So I gradually and in steps got, let's say, a bit more familiarized with different aspects of the publishing process. And then at some point, I also contemplated or I gave time to different efforts that could lead to a publication, starting from some, let's say, more orthodox or conventional routes, being, for instance, working in a laboratory or wanting to contribute to a big study. In time, of course, I understood that this takes a lot of time, depends on the results, depends on the availability of time. And then at some point, together with a colleague that we met at one conference in Greece at the time, and that she needed a publication for her residency application, we decided to try to write a letter to the editor, which is not a big deal, but was a courageous step at that time for me being at the fourth year, if I'm not mistaken. So we tried that. It eventually worked. Initially, we focused on quite, let's say, medical topics because, to be honest, I thought that this is what publications are about, or I thought that this is only the issues that are published, clinical medicine or biology. And then after that, and after seeing that I got to meet people who were into this, and after exchanging knowledge, inviting each other to collaborate, after having also a lot of rejections, I got to familiarize myself with some types of writing, and then be tasked to do other types of writing that I learned by doing. So yeah, just stay, let's say, convinced that one day you will succeed. But happy to
Juniors
hear
is
the perspectives of others.
juniors should be focused, and they should go slowly. Yeah, keeping focus for a long time is tough. So I'm now going to Dr. Basinoy. You are doing global health projects for a long time. So what is your journey, and what you want to tell to your juniors and the upcoming generations?
Thank you so much for having me. I hope you can hear me now. Before I start, I just want to ask if everyone here is an Indian student or graduate, whatever, but all of you are Indians, right?
Yes. Stop there.
I'm asking this question because Indians, students or graduates, have like a special place in my heart. I have worked with like hundreds of them. They have the reputation of being hard worker, and you know that already, Makarji. I have a lot of friends from India, actually like close friends. And I'm asking that because my situation in Egypt is like India. Christos, I'm not saying that you are in Greek and Greece has some privilege, but in Egypt is like without any resources to start your academic career or whatever your aspiration in global health. So I was the first in my family to enter the university, especially medical school. And if any one of you identified as first generation medical students or graduate, will relate with the struggles we all have to start a career in academia or global health, whatever. So I started my medical school. From day one, I got interested into research, especially as Christos said, medical research, because I'm a medical student at the end. So I started to learn how to do research, writing, biostatistics, how to communicate with journals and all of this stuff, and started to volunteer on international projects, like contribute to collaborative project and all of this stuff. One of my first publication was collaborative project about global surgery on pediatric patient, oncology pediatric patient. I had 3 publications from this project. And also there was another project was about Yemen during COVID-19. It was like a commentary about the health situation in Yemen when the COVID-19 escalate and all of the stuff. And during this period, I started volunteering with a newly co-founded society called SAG, or Students Against COVID, from where I have known Christos like for 4 years now, or 5 years. So my contribution to global health started like that. I got interested and passionate in research, so I started to learn research and how to do it, so I can be ready to any collaboration. And with consistency, and this is the most important thing if I want to advise any one of you, to be consistent, because the research field or the global health or like the academia is very boring. And I'm saying that it's very boring, and it's somehow you have to have passion. You have to have not just passion, because passion can end at any time with the struggles, with whatever happening in your life, because you don't have only your career, you have the whole life around you. So by consistency and perseverance and hard work, and this is what I know about Indians, that's why I asked it at the beginning. So just keep pushing that you want to achieve something. Whatever it's long-term goal, short-term goals to have a residency in US, for example, or any other developed country. But again, if you want a final advice from me, is that you work towards your long-term goals, more important than just short-term goals. And this will start by sitting with yourself, asking why I want to do global health, or why I want to learn research, why I entered medical school in the first place. Is it really you want to be a doctor, or just the peer pressure and the community pressure? Because you can be brilliant in any other field, but this field is that what you love or what you have passion for. So was my foil, or was my internal motivation all over this years, or it's about 8 years now, is that I love what I do, and I love contributing to global health, to doing research, not just to have a residency spot or to have a job abroad, but I'm doing this because I love it, because I see that it is a must for you as a doctor or as a medical student to be a researcher.
Deep line you have. Next, I'm going to Dr. Salman. Dr. Salman, you have been a great experience in public health, and you have served a lots of organizations. So, what is your journey, and uh, how you managed like the MBBS study in India and the extracurricular activity? How you managed the both the things?
All right. Thanks a lot for giving me the floor. And to be very honest with you, it's not easy to encapsulate in just a few minutes the entire 6-year journey of MBBS, and then simultaneously doing global health related stuff, which are in our society known as quote unquote extracurricular activities, which uh, sort of hold no value in the traditional Indian society, sadly. Although that is steadily changing for good. As cliche as it may sound, in my first years of medical school, I knew I had a strong calling not just towards clinical medicine, but also integrating clinical medicine with broader systems in place that shape health outcomes, like your social systems, your political systems, your environment, as well as the economy. And that's what led me to sort of get involved and sort of experiment with different organizations to begin with. I was in the Road Track Club. I was in an organization called Switch India. I joined Medical Students Association of India, through which I ended up in the international space in the International Federation of Medical Students Associations, or IFMSA. And that's when I found a platform to advocate for, you know, public health issues and global health issues that deeply resonated with me. Uh, just to give you an example to help you understand my thought process as a medical student, in second year in pathology, all of us have studied chronic obstructive pulmonary disease, which is also known as COPD. What are the things that we study? Your FEV1 decreases, your FVC, which is forced vital capacity, decreases, and if I'm not wrong, your total lung capacity on the contrary increases. This is what second year MBBS students learn. My thinking went beyond, okay, how about um, what would be the difference in recovery in two patients? One of them is living in a very highly polluted area with a terrible air quality index, and the second person is having privilege of clean air. That got my curiosity going, and that got me going into the advocacy space, and eventually also research, because research and advocacy and your activities in global health go hand in hand. You can't do advocacy without evidence. You can't generate evidence for nothing. Evidence is a tool which is used in advocating for health issues. Eventually, I ended up trying my hands at symposium competitions and also the international teams in the IFMSA. I was lucky enough and privileged enough to get support from my parents, especially during my final MBBS and internship years, which you all know is very hectic and you can't get to do a lot of things apart from your clinical years and internship years as an Indian medical student, as you may know. I got my parents' support, my university's support, which was not adequate, but still, there. Uh, I ended up being the first Indian to ever be the director of public health in the IFMSA, followed by the first ever Indian to be the liaison officer of public health issues, which basically means the spokesperson of the organization when it comes to public health issues in IFMSA. The journey, it was not 100% easy. To be very honest with you, I had to skip classes at times. I had to compromise with my academics in some shape or form. For instance, when I became the director of public health and then the liaison officer, I split my internship year, not in 1 year, but into 2 years. So I did 6 months of my internship in the first year and then 6 months in the second year. As a result, I was academically behind compared to my peers. But then I took it as, looking from a holistic perspective, and I knew, okay, I'm doing two things at the same time. So it's okay if my timeline with my clinical internship year is slow. It's completely all right. And with the NMC deadline that was launched from our batch, that you have to complete your internship within the time period of 2 years, was even more like a ticking time bomb over my head, because I had to be on point with my time management skills, on point with my prioritization, deciding where to let go of, your clinical rotations, and then, have that as an extension, or deciding which activity of IFMSA should you not prioritize or delegate to people. So how I navigated this situation was time management. It's easier said than done. Prioritizing your own things, knowing which things should be urgent and important for you, which you should get done with right away, which things are not very urgent but important, which you could rather, delegate to people. The things which are not important but urgent, you can sort of, get the team rolling to do it for you. And the things which are not important or urgent, you can just, skip them for now. So I learned how to compartmentalize my time, my energy, uh, and how to accommodate classes with clinics, vice versa, how to accommodate projects, joining calls, coming from, when it comes to global health, a lot of global health organizations, unfortunately, are still very Eurocentric to begin with. So, I would join calls at late hours in the night, and then, get cut off some sleep and then wake up the next morning for my internship. So time management, I would say discipline, and most importantly, my passion and my willingness to do more in the global health space kept me going. And for your information, I'm not doing USMLE or PLAB or any other foreign exams. I intend to stay in India for my clinical practice. If I end up doing residency, and I'm also studying for NEET PG right now, although the preparations are not the best as you can imagine. uh, After my journey in IFMSA, I ended up joining as a consultant in React. React is an organization. React's name stands for Action on Antibiotic Resistance. It's a 20-year-old organization that's been working on AMR, and I work in the Asia Pacific node. So my work in global health didn't feel like a distraction from medicine, to be very honest. On the contrary, it enriched my knowledge in medicine. It gave me context to diseases I was studying, and it also taught me the value of empathy, the value of voices. In PSM or in community medicine, we learn about epidemiology, we learn about statistics. Global health, gave me a face to those numbers in a way. Uh, and last but not least, taught me how to work, as a team player and as a leader simultaneously. And of course, uh, research comes as a very important skill there. So this is how, in a nutshell, I managed my journey as an Indian MBBS medical graduate. Not very easy, but I made it through, thankfully.
That's actually wonderful. You have done a couple of these calculations. Wonderful. Because in India, the thinkings are not that much like the doctors will do research or a doctor will or a mental health or something like that. A doctor will do need PG and they will take some medicine or surgery and they will do the clinical practice only. So in that Mediterranean concept, so you are doing global level from the MBBS level is not a easy, I know, because so people, your couple of people will criticize you like why you are doing this, why you are doing that. This is a big problem. And now I'm going to Dr. Harshita. So what is your journey? Because you are also attached with different organizations and you are a climate, you are working with climate change, mental health. So what is your journey and how you cope up with your MBBS curriculum and you give your output as mental health as well as MBBS.
Thank you so much, Dattatreya, for not only inviting us on this panel, but also for this particular question. Unlike most of my peers over here, I'm actually fortunate because I'm not a first gen medical student. I'm actually a second generation medical student. My mom's also a doctor. And I've wanted to be a doctor since the age of 4. So completing medical was like a dream come true for me. But if you ask me what really got me interested in public health, I think it was always like I'm someone who makes plans. So I had a plan that I really wanted to work for WHO and Médecins Sans Frontières, which is Doctors Without Borders. And this was like a dream for me that I wanted to do at the end of my medical career. I was like, I need to gain a lot of experience first, and only then would I be able to really consult and work out. So, as a young medical professional or a young medical student, I was of the impression that it is not possible for us to actually engage in the global space. And I'm so honored and privileged to be alongside in this panel alongside people whom I've looked up to, like Christos and Salman, because when they were already making waves in the space of global health, that is when I decided that, you know what? I can jump in, I can do something in public health. For me, I guess this entire passion started with wanting to one understand myself better as someone who was like recently diagnosed with PTSD induced double depression. I found myself really alone and I really didn't understand my diagnosis because looking at it from a purely clinical perspective, I didn't exhibit all the symptoms I was supposed to be. I was still able to manage the workload, I was still performing academically really well, I had a group of friends, but internally I really knew that I was suffering and I was struggling to get out of bed. So that is how I started my journey into public health, where I was like, I want to do something that will help me understand myself. And the more I stepped into the field, the more I realized that this is a place that everyone's trying to find themselves. It's like a whole ecosystem, where people are constantly trying to understand what can we do better. And like a lot of the panelists before have said, and even Salman mentioned, right? Like there's a face behind all of these numbers, all of these statistics that we're reading. Why is it that a certain disease is presenting in a certain population and in a certain way? And how do I ensure that, especially in a resource limited country like India, that's obviously improving right now, can I give my patients the best outcome? So for me, I think it started from there and it slowly expanded. I was also quite fortunate that I had mentors in the space. So I worked with an organization called as SIMSA. It was the South Indian Medical Students Association, and my mentors over there introduced me to humanitarian affairs, diseases, and I went to this training of disaster medicine where we had a simulation of a railway accident. And for the first time, I was 21 years old, and this is really embarrassing to say, but quite an eye opener that I heard for the first time that disasters are not natural. And I was just like, what? No, no way. Like I've been reading textbooks, I've been reading stuff, I love reading stuff. And I haven't come across this. So, what do you mean when you're saying that disasters are not natural? And when I really went into like the depth of it, that was when I discovered that most disasters are caused by climate change. And that is when I also read that climate change is one of the biggest global health threats of the 21st century. And I knew that everything that we worked so hard to create in our healthcare system to really advance the sustainable development goals would all be overturned if we could not, focus on something as important as climate change and really give it the priority that it needs. So that's how I became a climate health advocate. But if I had to tell something to someone who's starting off today, I would say that the best time to start is now. I mean, you have to start somewhere if you really want to get something. And the more you involve yourself in the space, you should learn to question everything and anything. Don't take things at face value, because a lot of research that is done sometimes does not have all the variables. And I feel like methodology is one of the most important parts of research, because you not only understand who has been included, but who's been excluded and why has is so important when you're actually realizing how you're making a clinical diagnosis, or why a certain disease is presenting in a certain way, or why a particular treatment is being provided to a certain person or a certain stage of the disease. Um, and it also ties in very nicely with the kind of advocacy work that we do and policy work that we do, because we do keep calling for evidence-based policy, and there is so much around us. I think the next important thing I would say is really listen to what your patients are saying, because I know a lot of us said that it was really difficult for us to manage medical school along with being at these international platforms or advocating. But till date, I honestly believe like I've learned more from my patients than I have from medical textbooks, because they're people who live with the disease, and they understand how it's affecting them. They're able to communicate that to you. And I think that's the third part of it. You need to acquire good communication skills, and that comes with practice, because it's not only about touching somebody's emotion and causing behavioral change that will affect their life and lifestyle for the coming years or even days, but it's also about making that small change that gives them a hope for a better tomorrow, and I feel like that's what keeps me going every single day, like when a patient recovers and they have that smile and they're just like, you know what, I'm going to do something with my life. Because just imagine if all of us, we had that drive to just do one thing differently, and that one thing was something better, then we could make the change already ourselves. So yeah, these are my tips, and I hope that helps.
That's one wonderful and sharing your journey. So now, Kartik, yeah, you are the youngest one, and you have done this in quite a young age. Like you have started this in the school's age. Like when we are preparing for our like medical entrance exam or board, you are preparing like for global health. That's wonderful, because in at your age, I don't know what is a global health is. So that's the fact. So what is your journey, and how you understand that global health is so much important, and it will have a prolonged impact on the generation.
Hello, am I audible? Can you please confirm? Yeah, thank
Yes,
you.
you are audible.
So, very good evening. As I can see, most of the people have joined from India and few from other countries. So, good evening, good morning, good afternoon, based on the place you have joined this call. Uh, I was like smiling when the moderator introduced me as Dr. Karthik Verma, and which was something which my parent wished if I could have done. But I rather, I think I haven't chose this way and this domain to work, but rather than it have been lot of happening factors which draws my inclination toward this thematic and this area of work. Um there were no big reasons why I started working. It was just a matter of fact that I wanted to do something. I started doing it. I started working with government schools in my nearby areas, around 30, 40 government schools. Then in public buses, public spaces, no organization, no mentors, nothing. I was just doing something. And after some time, something happened. I because I was doing something, people were asking question that why you're doing something, what is exactly you're talking about. I was talking climate change, but I myself was not knowing what is climate change. So lot of things. I think that's the place where we all start with nothing, and then we evolve our interest. Then I read something, then I engaged into the global spaces. I worked with UN Committee on the Rights of Child on children's right to clean and healthy environment, which is the General Comment 26. It's a general guidance to all countries who have ratified the convention. Apart from it, worked with UNEP, UNICEF, I'm currently working with, and couple of other organizations, including Save the Children and other. So I think that's the very broader journey, but I would not create a hype. It's something very basic, very normal, and yeah, there have been a lot of factors which influenced uh, me being in this space. And I think everybody have their own story. Everyone have their own happening factor. So like I never put like a lot emphasis that how people can come into this space, how people can engage. But I feel that okay, there is one thing, that interest is something which matters. uh, and when interests, we always like see that what interest we can hold, how we can make things possible, how we can make things feasible. As Dr. Harshita was speaking, that the methodology of research is something which is very important, that what stakeholder, what community, and what people I'm including in my research. But there's one factor, while including, we are constantly excluding certain and a lot factors. So how that mapping can be done in more inclusive and just way, how the intersection points can be identified. I think that's one of the major thing. But also I think when it comes to the global health, when it's come to the one health concept or some other, I'm not a medical professional, so I don't know a lot of terminologies. But yeah, one thing I can surely resonate, that everything is interconnected to each other. It's a broader system. We are part of the system. Everything influence each other. So recently we are having a negotiation going on plastic pollution. So how the plastic waste and plastic can be, managed and tackled down. So it's into the final stages of its negotiation. And because I have been following that space, and one thing is very constant, that how plastic is, impacting human health, or planetary health, which is very much visible. But how it is impacting human health is a matter of research, which there's already a lot of papers published, but still there is not much research being done in this space, that how it is impacting children, how it is impacting like men and women differently, what are all other factors. So that's also opens like a lot of doors and windows for medical domain, people coming from that space to do research and validate and come up with something concrete, which would contribute to this global processes of policy making. And I think I have a couple of amazing friends who are working with UNFPA, WHO, and other, and they are working on One Health concept. So this is something which is there, but majorly, like, it's majorly about interest. So yeah, to begin with, I think interest is something which really matters. I'm not in a state of giving suggestion. I think it's also not recommended. But yeah, I strongly believe and say that everyone finds their own way. You need to look for your own way, that how you want to indulge in this process, how you want to take it. When I started working, we had a children engagement in the global space, which was very limited. I started the first time children engagement at a ministerial forum, at UNIA, at ELCOI in India. Fortunately, I was the first, like, youngest delegate from government for the first time at COP29 is at the age of 19, and which was only feasible because there was like a lot of work being done, and it's very difficult to get things done, how the bureaucratic and the systematic processes works here in India. But there's one thing which is very common. There's one thing which is similar in all domain, all spaces that I had an interest. I learned about it. I made a thought on it. I thought on the practical ways to take it forward, and I took some action to take it forward. And I think that's the simple thing, and that's the common story we all have. But yeah, not very fortunate, not very cause oriented, factor oriented. But yeah, there was something which was going on. I just flowed in path line, and now I'm here speaking here in this call. So I think that's all from my end. But yeah, looking forward to hear. I know a couple of people present in this call, and I had certain exchange over LinkedIn's and other platforms. But so really looking forward to hear them. Thank you.
Wonderful, Karthik. That's so inspiring. So there was a question from for Dr. Salman, and I think he has answered it. So the question was from Ala Nazim. So hope you have got your answer. And I can see the question. And next I am going to the Pandit Kaur. So Pandit, so you have a very innovative way of doing awareness program through poems. So what is your journey and how you come up with an idea that we should brought the awareness programs to poems?
Thank you so much, Dr. Dattatreya, for bringing me here. And it is such a pleasure to be doing this with Christos, Harshita, and Karthik, because I already know them. So it's quite interesting. And the question that you posed me is quite different from what the others have been posed. So first of all, I just want to introduce myself as the founder of Poetry for Planet. So we are using poetry and storytelling to empower and heal the world. And what we are basically focusing on and how it relates to the conversation today is eco anxiety. So, all of us who are in the climate space, we have been facing eco anxiety, which is the psychological stress and anxiety that you face as a result of being in part of the space and also being in this ecosystem. So I realized that the being in the space myself, I've felt that there's a lot of pessimism in the space, and there needs to be a way to counter that. So poetry, I've always been a poet since a very young age, and I realized that it has allowed me to heal myself and rise above the circumstances in a lot of especially in 2022. I remember particularly I hit a rough patch, and I used poetry to heal myself. Like it really allowed me to rise above my circumstances. So um, and then in 2023 we launched Poetry for Planet, and the idea is to use poetry to heal, and through a very positive outlet and a positive medium. So it has been a journey where I first saw the impacts on myself, and then I gifted it to the climate community. So poetry has been there for me, and also I believe that the global health can really expand to and talk about innovative ways in which art, literature can help people heal themselves, because I really believe that we are meant, as creatures, we are meant to enjoy and to de-stress ourselves through these beautiful mediums. So, also being the official poet of World Food Forum, I have realized that it connects people like nothing else. Like that is the power of poetry. So, we are all from India, and you know that the economics, the politics, and everything is defined by the stories that we tell ourselves. And as you know, that we come from a land where Mahabharata and Ramayana define everything around us. Even, there is one interesting thing that I realized is that we face a lot of issues in advocating about menstruation in India because of how the stigmatization of it. However, we can use these beautiful stories and especially take inspiration from a religion itself, especially the Kamakhya Devi temple. So Kamakhya Devi temple in Assam is known for this its power of fertility. Like that's the goddess of fertility, right? That's the seat of the goddess of fertility. So in India, we can utilize stories and poems to basically advocate about public health because that is how we use stories. So I really believe that poetry and stories can really heal the world in a very different way. So yeah, that's what I wanted to share specifically regarding poetic intervention in this space.
Thank you all the panelists for sharing their beautiful journey. And so we will go to the next part of the panel discussion. So the question is for Dr. Basinoy. Hello, Basinoy, are you there?
Yeah. Okay.
So the question is, as you know, that last year Egypt has eradicated malaria totally. The global health perspective, that how your country made it and how other countries can eradicate infectious disease. What is the top five key points you want to advocate to all the young doctors coming?
Yeah, actually, this is a very interesting question because malaria in Egypt is like back to years, like thousands of years ago. Everyone knows that Egypt is the land of ancient Egyptians or pharaohs, as you know, it's the pyramids and all of this stuff, this civilization. Malaria as a disease or as the mosquito is doing this disease, they found it in the bodies of mummies. If you know the king of Tutankhamun, they found the malaria or traces of it in his bodies. So this disease was like been in the neck for the Egyptians for thousands of years until 1920s. I think they started to have what's called the national program to track the areas where there was like malaria epidemic or outbreak. So from 1920s till 1940s, around the World War II, malaria was like controlled in Egypt. There was disease, but controlled. Until after the World War II, it happened a very big epidemic because of lack of supply. You know, during the World War, Egypt wasn't involved in the war, but everyone in the whole world was affected by the war. So the malaria was an epidemic all over the Nile. Because in Egypt, if you don't know the geography, we all living along the Nile River. And this is the places where there is a lot of outbreaks for malaria. So what happened after the war is that the political community or the whole country started to develop what's called a national program to eradicate or eliminate malaria. And they started to with the advocacy group and with the Ministry of Health to create what's called the mobile health workers to go through all the Niles, all the governments on the Niles, and started to doing screening and surveillance to assess the status after the war. And from this step, they calculated the prevalence and started to give the vaccines and all of this preventive measurement, like the nest for people, bed nests around the Nile, who's living around the Nile. And for this, I think 70 years of efforts, they managed to eliminate malaria from Egypt, and Egypt was malaria free after thousands of years. And I think this is the first important thing they do, that there is a political authority, like or political call, and along with the Ministry of Health mobile programs to go all over the country, and the advocacy group who like doing infographics and social media posts about all of the risk of malaria and all of this. So they managed to eliminate it.
Wonderful.
And if I want to respond to your last thing, what if the other countries have to do? I think the WHO report is very detailed how Egypt and the other countries like United Emirates and I think Morocco in North Africa managed to eliminate malaria. I think if you want to read, if you want to learn in depth and in steps, you have to read this report because it's very well written and documented all the steps they took to eliminate malaria.
Wonderful. So I can recommend all the attendees that so that um, uh, so next question is Dr. Salif. That you are working greatly in antibiotic resistance. Antibiotic resistance is a big problem in the world. It will be the major cause of mortality. We are facing problems in our world because of it. So, what is your views on this in the Indian aspect, and what is your suggestion to our juniors or we as a young doctor should do in medical practice to reduce the antibiotic use?
Thanks a lot for the question. Unfortunately, I couldn't hear most of it. Uh, Apologies. Could you please repeat it again?
Okay, okay. So the questions are that what is the opinion of yours about the antibiotic resistance in Indian scenario? What is your opinion? And what is your suggestion to our junior doctors or upcoming medical students and medical students what they should practice in the ward to reduce the incidence of antibiotic resistance?
All right. Thanks a lot for this pressing question. I think when it comes to AMR, India is one of the countries that's in a big mess for multiple reasons. We have this culture in India wherein people do not really go to the doctor unless they are on the verge of dying. Let's put it that way. They pop antimicrobials and antibiotics like candy. Most of the population, I'm speaking about the general population, they don't know the difference between an antibiotic and an antimicrobial. And we as healthcare students and healthcare professionals end up knowing the difference. But sadly, the general population does not. Then we have issues like self-medication, as I said, poor regulation of antibiotics. Uh, but one issue that I'd like to highlight here is that AMR, as we call it, is still technically seen as a medical issue by multiple health professionals. AMR is not just a health issue, it's a development issue. It affects multiple SDGs. Uh, you know, we see people being pushed to poverty, people dying of hunger. Uh, there are growing evidences related to the intersections between climate change and AMR. Uh, People take, let's say, because of a drug-resistant infection, people stay at homes for a longer time. That affects their productivity and, of course, the economy of the country in general. And AMR also exacerbates gender inequality, to be very honest with you. Uh, Not to forget, we are a home to a highest number of or a highest proportion of TB cases, wherein one-fourth of the multi-drug resistant tuberculosis belong to India. And this is not me just picking it; it's out there in the WHO's global TB report. What's wrong here is the cultural mentality of us as Indians, along with the issue that is, just siloed in the health sphere or in the medical sphere, to be very honest. We use 70% of livestock productions in that antimicrobials are used in some shape or fashion, which we don't really talk about loudly. We use pesticides, we use antimicrobials in agriculture. We use them left, right, and center like candy. The regulations are in place. Let me be honest with you. India has done a great job in regulating things, in having plans in place. We have the National Action Plan on AMR, and hopefully soon we'll come up with the second version of the NAP. However, at the grassroots, the reality is quite different. And when you do an analysis state by state, the issues, or let's say the progress when it comes to tackling AMR is different in different states. We have high performing states like Kerala that has good regulations in place. Whereas, I live in Mumbai, but I can go downstairs at the local chemist nearby. I can buy an amoxicillin for nothing and I can pop it like candy. So you see that it's a multi-layered issue, and you can't really solve it just by being in the clinics alone. First, we need stronger policies. Policies exist, but then we need a bit more stringent practices to regulate the sales of antimicrobials. Prescription-only rules need to be followed very seriously, which are unfortunately not seriously followed at the grassroots levels. And we as healthcare students and healthcare professionals play an important role here because we are the ones who are trusted the most in the community, at least in our Indian society, and of course, even in the world, health professionals are one of the most trusted professionals. What we can do is we can talk about this issue in a layperson's term instead of medical terms, which is still not being done. Last but not least, this issue, as I said, it's not just a health issue. It's an environment issue too. It's an agriculture issue as well. It's a development issue. So just healthcare professionals alone can't solve this issue, despite it being, contemporarily or traditionally backed in as a health issue. So there needs to be more collaboration. And we as healthcare students, we are, I'm sure some of us might be in touch with some students who are doing veterinary sciences, some students who are doing agricultural sciences, some of us, having friends who are studying pharmacy or pharmaceutical sciences. That's how we can sort of, have conversations with our own friends, talk about this issue, and then come together with projects. There are multiple organizations in India itself that are working on AMR related projects, and they are working together, different professionals. So it's a multi-layered solution for a multi-layered problem. Um, and I think I'll stop now. I can go on and on about AMR because it's an area of interest for me. But given that we just have 30 minutes left for the panel to conclude, we have a lot of questions left. I'll just, shut up at this point.
Thank you. So I'm going to Christos for the another question that like research is we should do the research in focus of SDG so that we can achieve the SDG by 2030. Currently in 2025, what factors we are missing? Like one or two factors if you can highlight.
Well, now you're giving me a difficult question, I have to say. But instead of complaining, I will try to come up with a response. So certainly there are a lot of challenges within the healthcare field, a lot of challenges outside healthcare, all the way from economy to climate change. See, for instance, even climate anxiety, a problem that creates a different problem, and we need to respond to them. There are, let's say, two approaches. One approach that is fortunately or unfortunately quite loved among many people and entities and communities in the global health and probably surgery space is isolating a problem and trying to concentrate resources and attention on that, saying that, for instance, that disease one is the most important thing right now, we need to act on that, or disease two is the definitely most important thing, and so on and so forth. But this, at the end of the day, leads to a fragmentalization of our field and also of our efforts and the attention that we can attract. So the thing is that at the end of the day, we need to have a unified, common, and simple to comprehend willingness or need that needs to be addressed by a fundraiser, by a policymaker, by a capable body, and so on. So instead of isolating two problems, I would suggest an approach in which we try to find the common grounds that combines a lot of problems. For instance, in surgery, the availability of blood. This is a problem that concerns any type of surgery and any surgeon, because even in a high income country, you cannot buy blood. So this would be one cause, but this is an example. The thing is that we need to find a niche that allows us to put together all our voices and achieve a goal that allows us to maintain a good level of care in our area. Another thing that I'm quite involved is cancer. I got involved as a student, being the youth ambassador for Greece, my native country, for the Association of European Cancer Leagues. And later on, I had the chance to join also some institutional initiatives, namely the Cancer Mission Board of the European Commission, where we are advising on how the European strategy on cancer needs to be implemented. Together with this also came some involvement with different groups of the WHO Europe about tobacco, alcohol, and unhealthy foods. Now, these are all different topics, but we can, for instance, focus on cancer and advocate for prevention, because we know that with prevention on certain types of cancer, we can prevent up to 50% of cases. And this will mean that the existing resources, which are limited, will be better allocated to everybody else that needs them. Or if we go to one of the substances that I named, tobacco or alcohol or unhealthy foods. That's of course a different subject of discussion, but and a difficult one. But one has to say that, for instance, in Europe, we have about, if I'm not mistaken, 700,000 deaths a year that can be attributed to alcohol and tobacco control. The number might be different, but what is a fact is that we have mortality across different sectors, age demographics, across different diseases. This concerns people with cardiovascular diseases, with cancer, people who come to me in orthopedics with trauma, people who come to or who cannot attain an elective operation. So if we concentrate our resources and efforts on solving some overriding and horizontal problems, then I think that the whole community can profit. And I think that we need to put thought on the linking problems that unite us.
Sides. Now, next question is to Karthik. Hello, Karthik. So, as you have worked with children, what is your views about the digitalization of like digitalization of child education? Like, is it important to give a mobile to a child? Means child means maybe 10 plus to 10 to 15 years old child. Is it good to give mobile to them? Your views in very short, if you can please.
Yeah, so I think this is a trick question. You're saying that giving mobile phone to children's somewhere above 10, where I'm seeing children's of age 3, 4 are having mobile phone in their hand and consuming content or engaging in lot various way. So it's bit debatable. But when you say on the very perspective to the education, you know, so of course, technology becomes very important for children's even to to be in the pace of global change, how things are transforming, because that is one way where they can come on the level and the level playing game field which we say. So basically I'm also working with Google to bridge the gap and to have certain foresight being done that how younger population, specifically Gen Z, perceive about technology. See, we may have very divergent thought that of course there's lot of health significance involved where I'm having a huge screen time. I remember my doctor saying that you should, shut down your laptop for a day at least in a week, which is quite less feasible for me because the kind of background I come from, I have to work and I have to be properly in this domain to stand out, to learn every day, because things haven't been same. I studied from a government school. I studied in a state board school, which is Hindi spoken. I had to learn. I had to, learn even to talk in English. So for me, it's have been very different. For me, of course, I can never disagree from this fact that, of course, digital, this entire context is very important for children's to engage in. But again, when I'm saying it's in the right direction of education, whereas on the debatable side, of course, there is lot of side effect as well. Not only because I have a screen time, I have some health significance, but also from the societal context that what content we consume. As Miss Kaur was talking about that how poetry transforms. I'm a deep lover of poetry. I think my Instagram feed is full of that. I randomly go and write to poets. I really appreciate what you're writing or what you're narrating. So so for me that's the content. For other it may be something very different. So and that's also describe that how socially we behave in society. So it's not just about that how physically or biologically internal and external body health is impacting, but how our mental well-being is being evolving with this. And also again there is I'll say with very strong emphasis on this that we need research on this, right? We need more and more research on this because still we don't know that how the behavior, how the psychology aspects is being transforming. Because 10 year before, a decade before, there was no much access to technology. There was no more much access to internet. But there is. When I was a child, I remember I got access to phone in 2019, which was again too late for me to get the access. But at least I got access, I utilized in the right direction. But in the last decade, it was not possible for me, for children from villages to have that access. But when they have, we need to determine that in what and what various way it is being involved. And
Actually,
again,
we are the generation we have seen the smartphone revolution and the internet revolution.
yeah, there's a very famous line which goes across the internet that we and our parents might be the last generation who may not know how to use and deal with this technology and stuff. At least in the village context, I can say this. So it's true and it's the fact. And I think we have to deal, we have to coexist. So I am not here to deny, disagree, but I agree it is important. But yeah, it's a matter of research and it's a matter of regulation, which we and as a parent, people have to identify that how they want to, at what extent they want to give the access to phone, digital access to their children. But yeah, that's my thought. Thank you.
Thank you, Karthik. So the next question is to Abhishek. It's on AI that we are on a AI stage that everyone is talking about AI from today to everything people are so much with AI. So recently, I read an article where it is telling that to keep AI, lots of water and electricity is required. It's that like tons of gallons of water. It's one in YouTube channel. It's told that it's the 8 years of Delhi's water consumption is required to keep one AI software. So do you think like what like should we make some climate like from climate change aspect from the water aspect? Should we come up with some good ideas or to combat this situation?
Hi, everyone. So, thank you for asking that. That's a very interesting question, I would say, Dr. Mukherjee. When we talk about artificial intelligence, I feel it's a very multifaceted, domain where it has its pros and it has its cons. And especially when we talk, being a healthcare worker myself, I understand that we have to focus on the SDG 3 about good health and all. So we can say that okay, AI has been helping us in a lot of ways. For example, we talk about very specific approach to specific diseases, and that leads to less diagnostic tests, no less wastage of resources, especially in countries like India where we already have a low resource setting. And then we talk about telemedicine, then we talk about okay, AI driven healthcare systems, AI driven management systems. So I think AI has been and very important tool, and it will be an important tool. And in fact, there have been a lot of school of thoughts that AI will be, replacing doctors for future. So I feel that AI will also be, something, it will be aiding the physicians, especially like countries in India. Again, I think it's a very need of the hour that we need resources like that. But coming back to the point that the resources that, the pros that AI is giving us, there's also a heavy price that we are paying through in terms of environment, in terms of climate change. So yeah, definitely AI has been impacting a lot of, these things. And if you talk about the SDG 13, when we talk about climate action, so just giving some facts, when the famous viral model that we came across, the GPT-3, so everyone was praising around. But why, if you see the initial training of that model, it is an estimated figures. I'm not, the figures might be here and there, but approximately 1280 megawatt hour of electricity was used for training just one model of GPT-3, that initial model that that went viral. And that's approximately 552 tons of carbon dioxide emission. So that's one aspect that we talk about. And then we come to the hidden water footprint that it has. That's one aspect, is the carbon footprint, and another is the hidden water demand that needs. So some people call it the AI thirst. So that's another thing. So while when the data centers, the Microsoft data center for OpenAI, it is estimated that 700,000 liters of fresh water is used. Because there is a question that okay, we all know that we can't use salt water, seawater for cooling down the system, but we know that okay, fresh water has to be used. So that's a huge amount of water. Talking at a very granular level, if you say that, for example, you put in 10 to 50 prompts to AI on chat GPT. So that takes around 500 ml of water, for cooling down that system. So this looks like a very small amount, but we look upon the users, the amount of prompts that we give in on a daily basis, especially when when you saw that a recent Twitter post by Saul, I know the OpenAI founder, about the Ghibli style that went viral, and that that literally fried up the model, the infrastructure. So, in such huge demand, we really need to have some solutions that require less, resources. For that, I would say, just keeping it short, we need to work on models that are more sustainable, that are less, energy demanding for the environment. And we need to come across the digital policies that have, that should be implemented on a global scale as well as a national scale, that can really, talk about all these things. And especially talking about these issues on global platform is very pivotal right now. And organizations where one health approach is being followed, this should also be one concern, that while developing efficient healthcare system, we should keep in mind that what is the carbon footprint as well as what is the water footprint of such models. Just to summarize, I would say that we should have a proper measurement of these impact, keep a transparent report, and also mitigate via sustainable innovations, models that are more sustainable, and then adapt and regulate on these issues. And then again, also one important learning that I learned when I started into learning about global health is leveraging partnerships. So we need to leverage cross-sector partnerships. I think that summation of all these things would really create a much impactful solution for the future.
Thank you for your great details. And now I'll go to Parinit. Like Parinit, as you have come up with an innovative ideas. So what is your upcoming what is your upcoming project? Like where you want to do your poems to awareness award the people, like any one disease or any one project you can tell in very short.
Yeah. Thank you so much for this amazing question. So currently, I've been going through something and I finally got the diagnosis of ADHD. So I think there's a lot of things in my life, quirks that I have that can be drawn back to ADHD. So one of the things I want to do with poetry is to raise awareness about mental health issues, and also especially like ADHD, how it has transformed my life because after that diagnosis, I'm looking at the world differently. And I took a lot of time. It was a lot of how do I say denial and gaslighting that everything is fine with me. But when you get the diagnosis, everything kind of shifts. So for me, poetry would be a way to raise awareness about mental health issues now. And second, I have seen that there are a lot of poets in the medical fraternity, and this is the second panel I am on. I am my background is in political science. I don't have a medical background as such. So being an oddity that I am, but I feel that still I find lots of poets in the medical fraternity. So it would be very nice to have something where we can have poets write about their struggles and also about these diseases and find a different way of communicating. They can write about anything. It does not have to be about the medical fraternity, but anything that they feel is relevant. So I would be very keen to explore like a broader collaboration with the medical fraternity to see how we can bring in poets because some of the best, even Christos is a poet, so that's a beautiful connection that we have. So it is quite interesting, and I heard that Karthik is also an amazing poet. So it would be great to bring that side and to encourage that side in the medical fraternity because there's so much stress in the field. So at least as a humanities student, that is an outlet that I would really, really love to offer. Yeah, thank you so much for the question.
Thank you. So now I'm going to Fatima. Like Fatima is a podcaster. So how you feel podcast can help in awareness?
Hi again, everybody. So first of all, thank you, Dr. Muskarji, for considering my opinion worth noting amongst those of speakers as esteemed as the ones we have on our panel tonight. I think I'd like to try and answer this question by addressing three aspects of podcasting. So the first is the accessibility of podcasts. As someone who started podcasting about 5 years ago now, I can vouch for the growing outreach of the platform. Like it's something that's becoming popular by the day, and not just popular amongst the older audiences, as it was thought to be before. Today, we also have the youth reaching out for podcasts for not just entertainment, but also as a source of information. So that's the first thing. And secondly, perhaps as a result of its accessibility, podcasting, provides a platform where complex issues, difficult issues can be talked about in a very relatable manner, in a more intimate manner, in a manner that the public is familiar with. As a result, this makes for a great tool for bridging knowledge gaps. Yeah. And the third thing that I'd like to point out about podcasting is how, just like any other social media platform, it provides for one place where, in the landscape of global health, for example, people beyond the front lines, like not just clinicians and physicians, but also academics and researchers and people representing the public, all of them can get together in one place and have meaningful discourses and fruitful discourses that can actually be of use to local issues at the end of the day. And yeah, it not just helps increase awareness about local issues at the end of the day, it helps to catapult these issues to the global landscape so that there's a bit of cross-cultural learning happening. So there's increase in global solidarity where public health issues are concerned. So yeah, I guess that's about it. In conclusion, I see a lot of potential with podcasting, and I believe it's time that we as healthcare professionals take initiative to reap the benefits that podcasting has to offer where global health is concerned. Yeah.
Okay, so now I will directly jump to the mental health aspect. So we have Dr. Harshita and Dr. Siva to talk about mental health. So the first question is to Dr. Harshita. How you feel that climate change is affecting mental health?
Wow, that's a really great question. So I'm just going to build on everything that our previous panelists have said about how it's all interconnected, right? Um, in the past, let me just ask you a series of questions and let's see how you feel about this, and we'll take it from there. So when it's really hot, right? Do you find it a little hard to concentrate?
Yes,
No?
this
You can
it
concentrate in
happens.
the extreme
It
heat, but somebody
happens
please provide me with
for
this
me.
superpower. Um, or let's
It
say
happens
when
for
it's
me.
when you don't have a lot of sunshine outside, do you feel like you might not be as happy as you were before? Like if it's always rainy days, it's always raining and stuff like that. Okay. If you hear that there's going to be a storm that's coming your way, are you going to be anxious about it? Are you going to be worried about it? If you feel like your voice is not being heard, like, like being listened to and people are taking action, do you feel like you're anxious and you're angry and you're also like, I need to do something? These are all like really, really small things, but those are all things that make up your mental health. The way that we look at mental health is a systems issue, just like how Salman was saying antimicrobial resistance is a development issue. Mental health is a systems issue, and it's one that is so deeply rooted in socio-political systems, because I cannot tell you today that you need to be in the best mental well-being when I cannot assure you that you're going to have a roof above your head, that you're going to have safe clean drinking water, that you're going to have food on your table, that you don't have to worry tomorrow about the air that you're breathing. How can I promise you that and then say at the same time, oh yeah, don't worry about it, it's just anxiety or it's just depression, it's just seasonal, it's just how you're feeling right now? It is impossible for me to say that. The second aspect of it would be, how would I address this, right? There are reports that have said migrants have increased incidences of schizophrenia in them. There are reports that say that certain populations of groups have increased personality disorders in them. But when you have climate change and that disrupts your entire life and you're living in, say, like a camp or something like that, and you're subjected every single day to violence that's not only emotional but also sexual sometimes, how could I then tell you that this is not something that's going to affect your mental health? So do you see how deeply entrenched it is? It's not that climate change is just causing mental health issues, it is exacerbating mental health issues that are already existing because of a lot of inequities in the system that already exists within us. And then you add the compounding layer on top of that, which is climate change. I would just like to bring in the point that everyone was saying about AI and also talking about it kind of replacing doctors and stuff like that. A lot of AI and a lot of these ways that we look at mental health or clinical diagnosis is a lot from like a Western colonized perspective. Even when we're giving a diagnosis, it's always based on, say, certain clinical aspects, which is why even when my friend Perneet was talking about ADHD, we were having this conversation about how ADHD manifests so much more differently in younger women and girls, with them having a diagnosis that comes in much later in their life. But it's not the same for male children. But if you ask that same question to, say, a trauma-informed therapist, you would get a completely different answer, because a lot of the ways that we respond to life every single day, that we live our life every single day, comes from experiences that we've lived with every single day. Not everybody is jittery around certain things. Not everybody's triggered about certain things. Not everybody would be angry about the same things. It comes because of the way that we've lived our life, because of the experiences that we've had, and the things that we have learned in order to survive. So if you ask me about even AI, I would say a lot of the responses that we get are also generated by people who are working on, say, like in the white space, right? You've had people say, hey, AI isn't very friendly to people in the global majority countries. Whenever you ask it a question, you get responses that are differently. But the same thing goes with, like, if you're providing a diagnosis, right? The entire aspect of it not being able to replace humans is because we have this element of human touch. We have this element that we don't just listen to just what you're saying, but we try to construct it into the being of who you are. Because mental health is a part of you, it's your well being. So I also one other thing about AI is a lot of people who do work on AI, they work on it back end. Not all these images that you get automatically that show up or these things. It comes in people living in like these AI sweatshops who are constantly inputting data. They're walking on these streets, they're taking pictures, and they're posting it up over there. I would recommend two things. One about AI would be try to use it as less as possible, even when it's you responding and trying to apply for applications. We want to know who you are as a person. We want to understand what makes you you and what drives you and what kind of impact that you create. We don't want a generic answer that says, this is something that I could increase my outreach with. This is something that I could take back to my community. That is stuff that we hear. We want to understand why it's important to your community. What is that one unique factor that we're missing? Why is it that your place has, been excluded from the table, or you feel that you need a spot at this place? And with mental health, I would say that the most important thing is to really build psychological resilience is community support, because the first ever response when any disaster hits or anything happens, it first not only comes from within, but the first person you end up calling is, say, your best friend or your close friends or your parents or your family, anyone who you feel you're comfortable with. And the second thing that happens is, how do they respond to you, right? Because when someone is being so vulnerable about something, they're sharing something that is something that's caused them a lot of distress, because we are also in an age that's constantly comparing each other and figuring out, why is it that I'm not able to do better? I think it's important that we come from a sense of kindness and that we go really back into our basic human nature and say, hey, can I just be there for this person and just listen to what they have to say? Because a lot of times just listening helps. And this thing about, wanting to sometimes self-harm or even like suicide, it's things that happen in minutes. And if you're just able to pass those 10, 15 minutes of having this really intense impulse and feeling, you've done it. So that's it from my end. I hope that that kind of gave you a different perspective on climate change, mental health, and AI. Back to you,
Thank
Dr.
you,
Mukherjee.
Dr. Harshita. I'm Dr. Shiva. Just wait for 2 minutes. Dr. Salman, there is one because you have some other works. I know this is going too many long and global. It's a big topic. So one question is for you that how that you have worked in tobacco cessation. So how we can use digitalization aspects in tobacco cessation? Then we'll get back to Dr. Shiva for the mental health aspect.
All right, thanks a lot for this question. And I'll have to leave within a few minutes because I have a work call that already started. Apologies for that. With respect to tobacco cessation, I can give you an example that I worked on as an intern in an organization. We were targeting a community in Jalna, which is in the state of Maharashtra. And we used in-person counseling as well as a real-time app that would sort of help us collect data or ask questions that people were ashamed of answering in person. Considering the stigma surrounding tobacco cessation, the fact that people still view tobacco cessation as a stigmatized intervention in a way in India, and we still don't promote help-seeking behaviors in our communities. So we leveraged, or rather made use of this app to figure out certain, questions. For example, do you feel comfortable while in the first 20 minutes after waking up? Because a lot of people who are addicted to tobacco consumption, be it cigarettes, be it BDs, be it other forms of oral or inhalational tobacco forms of consumption, because they are so addicted or dependent upon tobacco use, many of them can't even pass stools without having their puff of cigarette after of waking up in the morning, or having gutka, or having any other form of tobacco. So we had to ask these questions, which they would usually not, be comfortable answering it in a clinical or an in-person setting because of the stigma. And that helped us to sort of, tailor our counseling and nicotine replacement therapy, which helped us in a long way. So when it comes to tobacco cessation, digital tools can act as, a catalyst or act as a supplementation in a way in tobacco cessation programs and efforts. This was one example. Secondly, we come from a very tech savvy generation where we are constantly on our mobile phones using Instagram, X, Blue Sky nowadays, YouTube, Facebook, and these platforms are a good example of social media advocacy. Uh, WHO, for instance, has had many videos talking about people with stories, experiencing the harmful effects of tobacco consumption and also encouraging people to quit tobacco. And also, in a way, destigmatizing the entire conversation around, speaking up, asking for help, um, so on and so forth. Last but not least, the digital interventions, or rather, app-based interventions in tobacco cessation are booming. There's a lot of research out there. We have cessation applications that are being used in India as we speak. There are experiments and researches being done on the intersections of use of AI in tobacco cessation interventions. Unfortunately, I don't happen to have a lot of knowledge on that because I'm less well read when it comes to the intersections of AI and tobacco cessation. But yeah, this is how we are currently using digital platforms in tobacco cessation, uh, advocacy, raising awareness, and also generating health related data.
Thank you, Dr. Salman, and thank you, Dr. Harshita and Karthik. They have some other commitments also, and this is a so long topics that it's almost 1.5 hours. So thank you, three of you, for accepting the invitation and joining us, and has told all the great insights. Hopefully, the students will get inspiration from you, and they will pursue global health in future. So now I am going to Dr. Siva that you are a podcaster on regarding mental health. Why, how your podcast, how a podcast can help in the awareness process of mental health.
Hello, everyone. This is Dr. Shiva. Thank you so much for inviting me to this panel, amongst others who have contributed so positively in their respective fields. So, for everyone who doesn't know me, I've started this podcast named the Detox Podcast. And honestly, when I started this podcast, I didn't imagine it would tie into something as big as sustainable mental health or sustainable global health. But when I was invited as a panelist here, it got me into thinking about, and it became clear to me, how do we contribute to sustainable mental health? So for us, we started the Detox podcast with the sole purpose of starting a conversation around mental health, right? And which is very often ignored in the larger discourse. I'll explain you how we work. We bring in psychologists, psychiatrists, and therapists, to talk about everyday mental health challenges. And we have this special segment called Ask Your Therapist, in which anyone can share their questions anonymously to us, and we ask them to our guests. You know, people would message us with such deep, personal, and honest questions. It just gets me into thinking that the thought of raising awareness, just the awareness, is getting translated into such a meaningful action towards improving their overall mental health. And consider us as medical graduates or a medical student who just wants to, we have such bookish learning of all the terms, all the mental disorders. But what if we have to learn more about any condition? One way to do is that we can go up to our professors, sit with them, have a conversation. But isn't it tedious? Not just for me, but for them as well. And now imagine any common person, layman who wants to learn more, who needs help or seeks help. What can that person do? It's going to be so exhausting. And if we had to assign a credible psychiatrist or a therapist to each and every individual who needs help, seeks help, or just wants to learn more, it's unfathomable. It is, we cannot forget how extremely exhausting it will be for all the limited resources that we have at hand. And coming to the podcast again, what makes it sustainable? It's that the podcast lives on. It's not just a one-time workshop. It's not just a campaign. People can keep sharing them. The podcast can keep revisiting them. It can be used as a tool to understand their personal state better, because it's their own question being answered. And by this cycle of liking and sharing a podcast, which we podcasters love to say at the end of every YouTube episode, is to like, share, and subscribe. What we're doing, we're creating a ripple. We are creating a non-judgmental space, a dialogue amongst masses, right? Which is impossible if we have one-on-one interaction, or the standard practices that we have to go to a therapist, or just going to any video and just learning what we are. So I believe we're quite contributing to the mental health, the global mental health in a long term. And in the end, I would like to say something that I've been saying quite often of late, which is to go visit our channel, the Detox Podcast, and give a view to our videos, and do like, share, and subscribe. Thank you.
Thank you, Dr. Shiva, for your insights. Now I'll go to Dr. Christos. Another tough question. We know that Europes are very clean as per AQI, air quality index. So, what's you think that why the Europe is so clean and so fresh air are present there? So, what measurements they are taking in respect to the administration?
Well, I have to declare that I'm not a specialist in this area, but I'm familiar with the broader context and concept. And essentially, what is Europe? In the last decades, it has formed a political union of different independent states called the European Union, which is kind of different than the federal model that one has in the United States, or that the federal model that one has within some European countries, such as Germany or Switzerland. And I also need to distinguish European Union, which is a supranational organization of 27 states that follows some common, let's say, laws, or has some policy-making instruments, namely the European Commission, the European Parliament, the Council of the European Union, and the Council of Europe, and some more, that essentially create a framework, a legal framework, that all member states are expected to implement in the coming years. So in this frame, and in many cases, like in the case of clean air, in collaboration with the local healthcare authorities, there are European healthcare authorities like the European Center for Disease Prevention and Control, the European CDC, there is the European Medicines Organization, and there is also the European Regional Office of the WHO. So there are health-focused organizations that create recommendations that are applicable to policy, and then there is a process of the European governing bodies, if we can call them like this, that create this legislation and try to pass this legislation through the European Parliament. This is also a co-creative approach, in the sense that in Brussels, which is the capital of Europe, there is a big conglomerate of, on one side, non-profit or civil society organizations that advocate, for instance, for clean air, and they do that in a very concrete manner by, for instance, following all the policy developments, going to meet the policymakers, submitting amendments that can be proposed to existing laws that can relate, among other topics, to clean air. So all of this leads to a European momentum, a legislation that is centrally organized, and this gives time to the governments of the different countries to implement it. Of course, legislation is not enough. It also needs clear goals. For instance, some of the most clearest European politics were about the Green Deal, or about achieving certain goals by 2030, so clear goals and time frame, and monitoring mechanisms. So holding individuals or entities, governments and regions and so on, accountable for what they are doing. And abiding, of course, to widely accepted frameworks such as the framework of the WHO for clean air. So what this is, I think, the organizational base of how it has worked in Europe. And this is a model that extends to cancer, for instance, or to many other health issues and to many other challenges, especially in cancer and climate change and smart cities. There is even the so-called mission approach, where instead of having different entities like research, academia, clinicians, or civil society and so on working in silos, they try to merge their voices in order to create research questions or actionable items that concern everybody, not, for instance, what molecule we find interesting or what only the patients consider important without being aware of the clinical aspects. For instance, a patient would like to have a pill that heals all cancers. This is not possible. And a researcher would like to have a very specific research question, but if we put them together, they can define an actionable goal. So I think this is what Europe is doing. This is quite a good model, of
Thank
course,
you,
with a lot
Christos.
of challenges, but yeah.
Thank you, Christos, for the detailed answer. And now, sir, the question is for Basinoy that Egypt is really doing good with EY. So, what is the one thing Egypt's administration is implementing to get this result? Just one thing, if you can mention.
Thank you, Makharji. I think I believe I need to disclose as Christo that it is not my expertise to answer like question because at the end of the day I'm just a physician and researcher. But I can answer from my point of view as a citizen of Egypt. I live in Alexandria, which is a coastal city, very beautiful city if you want to travel. I over the around the 10 years, past 10 years, there was like a lot of changes in public transportation, from the gas vehicles to the the natural gas or the renewable sources of transportation. Also, all over the Nile, there is a very beautiful city called Aswan. There is multiple solar solar energy places in Aswan because it is one of the hottest regions in Egypt. I have been visited Aswan and I saw this myself. Also in Cairo, one of the most crowded city in the world, and I think you in India has multiple cities like that. So Egypt and India shares this struggle, which is a huge number of population. And I think from my perspective that the population is a very indirect cause of air pollution. Like why, for example, European countries has less air pollution because of their few number of population, unlike India or Egypt. So in Cairo, they expanded green spaces in the surrounding desert. So this is,
India is also,
I think, most, yeah, I think this is one of the three most reasons or measurement to reduce the air pollution in Egypt, but it's still an issue. And it will be an issue till the population number get fixed to not exceeding that, because from my perspective, it is always about birth control to for all the resources we want to for the country and all of the stuff.
Thank you, Basinoy. So now we are at the end of the session. So there is two more questions. One is for Parnit. Hi, Parnit. So the question is like we know the child education is a problem in India still now, and the like women, young women marriage or teenage marriage, teenage pregnancy. These are problems in India. And so, what is your point of view that how we can reduce women marriage in like your teenage marriage or teenage pregnancy in India? Like most like where in West Bengal I'm sitting, in West Bengal, it's the teenage marriage is very, like the under 18 marriage is very high, and the quality of education is not very good to the child in the rural spaces. Also, the problems we hear like in India we face like the malnutrition, undernutrition, poverty. So if we if in totally if you in a poetic aspect, how you can like what is the one thing you want to solve it first?
Thank you so much for the question. I think it's a very complex question, especially when we think about teenage marriages in India and the reason why it's happening. I think it's very context specific. Again, because some areas in India are more prone to seeing such an occurrence, while others, like I am in Chandigarh, so I don't see that because of the education level. So education definitely has a huge role in helping people realize that especially in parents, if they're educated, then they wouldn't force their daughters. So if I have to pick one issue specifically, that would be, I think that would be education specifically, because even to write a poem, you need to know how to write, right? Read and write and recite. And as you know, that these are some of the basic foundational skills required to acquire knowledge. Like this is the basic foundational skill. So I think through my unique ways of advocating for change, which is poetry, I would utilize it to help people realize that, especially parents and their girls,
You want to
young
educate the
children.
community first.
Yeah, absolutely, absolutely. And why I say poetry is because I think since you're from West Bengal, and also we have so many beautiful ways of communicating, right? In Punjab itself, we have shairis and boliyan and all of these, local ways of conveying local poetry, right? So I think that we can leverage to talk about these issues. Actually, we have had a tradition, and it still is, that you know about Nukkar Nataks, right? All of these are very, how do I say, context specific, local ways of advocating for change, right? So if I have to be particular, I think I would try to make people more literary, like more creative. Like I would try to uplift them in that sense, because we all have poets, we all have thinkers and philosophers in our society. But the thing is that we need to ignite them for change. So using poetry as a medium, and not just in English, in the languages that these people speak, right? That is super important,
People can
especially because
understand the
yeah,
fact.
yeah, absolutely. So that is one thing that I would love to focus on, like how we can bring in more people who speak various languages, regional languages, and then they can use that to spread the information about these issues. Yeah.
Okay, Parnit, thank you. So we are in the last question, that is to Christos again. Christos, that we are focusing towards the first two goal of SDG, that is zero hunger and no poverty. And both are very connected to economical aspects of the world. So what do you think, how a country can be economically very much stable? If like if you get the administrative position, what the first thing you will do to make your country economically stable for the last 10? The next
Well,
one.
you still give me tough questions, but I will try to keep it short. And of course, again, this is not my primary expertise, but having a master in public administration and one in European politics and governance, I probably have some insights into that. I will start with history, like Mahmoud, and say that in the philosophy of Aristotle, the goal of a city or a state is to be independent in the sense that it is self-sufficient. It can provide for anything its people needs. Unfortunately, in modern world, this is not possible in the sense that we have so many needs that we cannot use the goods that are produced in a certain demographic. Therefore, I think that the country needs, first of all, peace and economic development, and then stable and trustworthy partnerships with countries in the region, but also countries abroad. This is the basis for developing trade. This is also the basis for developing an exchange of knowledge and resources. And this creates the framework for having enough resources in order to address issues like hunger and poverty. However, one should also, this is, let's say, the external relations of the country. If we focus on the internal relations, we also need an efficient and effective administration system that allows, I will not say equal distribution, but allows distribution of goods and resources to all people, supporting the impoverished ones and enabling everyone who works hard to have a chance to sustainably and improve their living conditions. These are some of the prerequisites. Now, if we go back to healthcare, because this is where we belong and where we can start from, we need to understand as physicians or as practitioners in the broader field of healthcare that diseases are not only what we think. It's not only a heart infarct, it's not only cerebrovascular episode, a stroke, or a fracture. Hunger is also a disease. Poverty is also a disease. Poverty or homelessness are recognized risk factors for poor surgical outcomes. And I think that if we have a point to start, because we will not be starting by changing the legislation of the international relations of our countries, is to take action as physicians, not only to make sure that we regulated the blood pressure of the patient, but we took care that they will go after they discharge home to a place they can further heal and not to a place they can get sick again, running into a circle of poverty that will also create hunger for them and the people that depend on them.
Thank you, Christos. And this is the end of the session. So I'm thankful to all the panelists who have agreed the invitation for short duration of time. And I think 2 weeks ago, I planned a whole session. And I am really thankful everyone who have attended. So my last message to all the attendees that global health is a big aspect. You can see that 2 hours almost we have covered. Still now it's not unfinished. Although we have touched all the goals of SDG, the questions have covered all the goals of SDG, but still like one particular goal. It can be a 5 hours meeting. So this much depth it's needed. So hope you got some ideas and about SDG. You like whoever has completed third year, who have studied SDG in your PSM chapter. So with this and who are going to study, so this can be your inspirational factors. With this session, you actually got to know those people who are actually working in the global health field. So that last thing is that the Park is a big book. It's actually 5.5 kilo book, and it's not like mugging up and vomiting in the exam. It's PSM and global health is so much that it you can't imagine. So enjoy the subject. This subject is present in every other subject, no matter you study surgery, medicine, or obsgyny, or microbiology, or anatomy, any subject you are studying, all the other 18 subjects are connected to this one subject, that is global health. And what we are doing currently is was focusing to the SDG 2030. So we completed all the SDG that, and one SDG is left, that is goal 16. Goal 16 tells place, peace, justice, and strong institutions. So who are innovative things? You need peace, you need justice, and you need a strong institution and collaboration. So all the goals are interconnected, and goal 16 is connected by all the goals. So this is the take-home message, and hope after this session you got an idea about global health, and some of you will pursue your further career in global health. So, like it's not about MD community medicine. You can do MPH, you can do MD in medical economics, you can do MBA. There is lot of things like health planning, advocacy, policy making, health economics. It's a lot of things. Like you have seen the current NIH director, Dr. Jaya Bhattacharya, is a health economist. He is a MD PhD, and he has done PhD in health economics. He has also done BA and MA in health economics. If you try to choose a different career perspective after MBBS, you can do in MSc or MA economics. So thank you. Thank you, Christos. Thank you, Mohammad Basenoy. Thank you, Parinit Kaur. Thank you, Fatima. Thank you, Abhishek. Thank you, Shiva. And I'm really thankful to all participants who really listened 2 hours long deep lecture. Hope you have liked.
Thank you, Dr. Mukherjee. Thank you all the panelists for joining. Hope you had a good time, and of course,
Thank you, everyone.
They learned
Thank you,
something.
Bye-bye.
Thank you.
Thank you all.